Hey, I'm Dr. Bob Payne, a veterinarian at southkendall.com. Let's talk about hip dysplasia and how to treat it in dogs. Hip dysplasia is a malformation of the hip socket, this socket as well as the hip head. And with time, it becomes more and more painful. So obviously, we can use anti-inflammatories like NSAIDs, which are like Rimadyl and Zubrin and Metacam, things like that their veterinarian gives. You do not give aspirin unless your veterinarian okays it, and it's usually a one-time deal because aspirin can cause ulceration of the GI tract and make your dog cough up blood or bleed out from a GI tract problem. So do not use home remedies on that. We use glucosamines, aminoglycans, chondroitins, all these things we use in conjunction with NSAIDs or non-steroidal anti-inflammatories, and they really help reduce the pain. You can massage the legs, you can use acupuncture, physical therapy is good, exercise is good to a point where you don't want to overtax those joints. German Shepherds are obviously the ones you see a lot of genetic hip problems with, but you also see it now in Labradors and Bulldogs. And if you start seeing any signs of inability to walk or inability to stand up quickly or dragging a leg, you need to go to your veterinarian, have x-rays and make sure that's what it is, because sometimes things mimic it and they're not really hip dysplasia, but there's something like, unfortunately, cancer or a ligament in the knee that could be ruptured that mimics what looks like hip dysplasia. So you should try to, again, define it with your veterinarian and find out if it's truly hip dysplasia.